Greetings, Dr. Mark Winton here from University of Central Florida Department of Criminal Justice, and in this video I'd like to address a few different aspects of the drugs and crime course. And the first thing I wanted to mention is that I think it's important to step back and think about how each of us views drug use, drug abuse, and the legal system in terms of our own thought process. For example, when I teach the theory course, I ask students to think about how they think about crime. Do they believe that people are rational beings that choose to either commit crime or obey the law? Should we focus on criminal behavior or on the psychological makeup of criminals? What should we do in terms of punishment? Should we focus more on incarceration or rehabilitation or something else? And what are the best ways that you believe we can prevent crimes related to drug use? So a lot of this goes back to how we view our society and individuals and how this all integrates together. You know, on the one hand, we can look at agency, which is really the life choices and the ability of people to make decisions as autonomous individuals versus the life chances or the structures that are out there in society that that give people different chances to do different things and different opportunities, different exposures to conditions, and how that all relates. You know, the agency structure debate, or sometimes referred to as the free will versus determinism debate, comes into play there. And I think that's important to think about because that gets us really into how we think about the reasons that these are crimes and also what we should do about it. And that brings me to an article I wanted to mention, and this article was published in Wired magazine, October 2021, by Maya Salvovitz, and it's called The Pain Algorithm. The Pain Algorithm. Fascinating article. When I'm not reading scientific journals, I love to read Wired magazine because it has such excellent writers and articles on all kinds of topics related not just to criminal justice, obviously, but technology. And a lot of times I can bring in that technology aspect into my presentations because that's something I don't think we really have in our discussions, and that is, drugs and crime and technology. But this is a fascinating article. I think if you go online to Wired magazine, you probably can read it, and I'd highly recommend it. And I think this is one that's going to get you opinions on this all over the place. So she took a look at this whole idea of the prescription drug databases that are present in each state. And these are PDMPs, or prescription drug monitoring programs. Prescription drug monitoring programs. So PDMPs. This will allow healthcare providers to log on to the system and to see someone's prescription history. And obviously, this could be used by healthcare providers. And the purpose and goal of this is to prevent drug abuse and also to let the healthcare providers know when they're dealing with someone who might be have a drug problem or doctor shopping, which is a term that we learned in an earlier chapter. And in these computer databases, the healthcare provider obtains an overdose risk score. We're not sure how this is actually computed. There's some ideas behind it because it's proprietary information. Private company owns it. That's one thing right there that becomes hotly debated, is that should social scientists or government officials be able to verify the reliability and validity of these programs that can have very serious consequences for individuals who are prescribed medications. So this is a situation where we don't know how well it really works, or if it does what it's supposed to do from an outside researcher's perspective. And so what happened is that between 2011 and 2020, this program obviously succeeded in decreasing the opioid prescription rate. That the prescription rate, opioid prescriptions, dropped 60%. Okay, so right there you might say, well, then what's the problem? It seems like everything's well. No. At the same time, during 2011 and 2020, we saw that the overdose opioid death rate doubled. So something's going on here. So if this program is working to curtail prescriptions, but yet the overdose rate is doubling, we have to start thinking about the sociological ramifications of what's going on. And so there's conflicts between different organizations and researchers and healthcare providers and officials. And some of these researchers and some of these people studying these prescription drug monitoring programs have found biases and errors that have been identified, where someone would get a higher risk score and then maybe they would be terminated from the practice, or they wouldn't be able to get a prescription filled, and it may be due to error and very difficult to correct. So, but I want to get back to, that opioid prescriptions dropped during that time period, but overdoses doubled. Overdose deaths doubled. Overdose death rates doubled. So we have a big problem there, and so we need to go ahead and further investigate what is happening there. And I would highly recommend read the article. I just give a really, really brief summary there, but read the article if you can. It's very fascinating. I also wanted to mention that when we start talking about programs, prevention programs or treatment programs, there's so much we need to look at. And so when we evaluate treatment programs, we have to take a close look at the population that's being treated, or the population that's getting the intervention. We have to ask ourselves, what was the treatment population? By age, gender, socioeconomic status, region. We also want to look at what they're looking at in terms of how they define drug use or drug abuse. We want to look at how the sample was obtained, how large the sample was, the extent of the drug use I mentioned. And also we want to look at other things. For example, if we have a prevention or treatment program, we want to know how that program decides who to accept and who not to accept. And so that is a situation where, we might, if a program accepts the most challenging clients, they may have a very different outcome for a program that accepts the clients who are most likely to succeed. I remember when I was working in the sex crimes field, and I went to a presentation on sex offender treatment, and the presenter had just an amazing success rate. The recidivism rate was so low, I wondered how could that be, and I was asking him about that, and he was very forthcoming in saying that they have a very strict screening process and they only accept those who are most likely to succeed in the program and are least likely to recidivate. So it's like, okay, that's always important to know whenever you're looking at programs. You also want to know how programs deal with dropouts in terms of their program evaluation. That something that's important to look as well. Looking at the measures, how were the variables measured? Are they clearly defined? Are they reliable and valid? Are multiple measures used? And we often want to know how far out an analysis goes. Does it look, at the end of the program, 6 months out, 3 years, 5 years? So we want to look at that. That time perspective is important. Also, when we're looking at statistical analysis, we want to always consider clinical versus statistical significance. That I may tell you that I ran a program and there was a certain percentage decline in use of heroin, but it wasn't statistically significant. But you might say, but it was clinically significant. You always want to look at how recidivism is measured and if other crimes are included or controlled in the evaluation. Do they have self-report, report by others? Do they do medical evaluations, drug testing, for example? Do they look at arrests? Do they look at convictions? And so a lot of these factors are very important when we evaluate programs. And I want to mention that. So if you're seeing some materials online, in the news, in the media, in journals that are claiming success or lack of success, you want to take a close look at that. I can tell you that I have looked at some programs that have failed or have not done what they were supposed to do, but continue on doing, basically not doing much as far as helping people reduce their drug use. And I often wonder, why would programs that have been shown not to work continue to be funded and continue to be implemented? And I think part of that answer would be the politics that we always have to consider as well, right? It's there. If you work in the field, whether you're in law enforcement, corrections, social work, the prosecutor's office, the public defender's office, you're always going to have the politics that you have to deal with. I wish I had an answer on how to deal with it. I can tell you my own experience working in the field is it's a headache. It's a pain. But it's something to consider. I remember early on in my career when I was bothered by it somewhat. One of my supervisors, who was a psychiatrist who was helping me to become a counselor, said, "Mark, that's just the reality of it. You got to learn to deal with it, to cope with it, to understand it, to bring it into your whole system of practice and expect it. Because if you try to fight it, it's just going to frustrate you." And and that's, I think, important to look at. I wanted him to tell me, well, how do you change it? And he's like, well, I didn't say we're going to change anything here, but we need to understand it and how to deal with it, how to cope with it. So that's fascinating to look at. There's a lot going on, and if I make one statement about something going on today, someone's going to watch this video in a month, 6 months down the road, and things may be completely different. But one thing I do want to reinforce, and that is we have so much more work to do. We have so much more work to do to make our criminal justice system better, to address those that use drugs or those that have problems related to drug use and substance use disorders. We have a lot more work, and we need to get on that. I have seen some success with some new interventions, some innovative interventions. I've seen some success with politicians really trying to decrease the problems. And so that is something that I think is good to look at. And but they still have so much more work to do. And so I'll wrap this video up and keep it a little bit short, because it was all over the place in it, and you wonder, well, what was his main point? My main point: a lot of work still needs to be done. Thank you.